So plastic surgery is a very broad field of medicine. A lot of people know plastic surgery from the cosmetic side because that's the glorious side that everybody makes TV programs about. But truly, only probably 15 to 20% of what the average plastic surgeon does is cosmetic related. So here at Froedtert South, I have the luxury of being able to offer patients the cosmetic procedures. We can do breast augmentations, tummy tucks, liposuction, we can do arm lifts, eyelid lifts, we can do all of that stuff. And I really enjoy doing all those procedures. But what I also like is that here at Froedtert South, I'm able to do general reconstructive surgery. So I'm able to help women after mastectomies to rebuild what they've lost. I'm able to also help patients who have wounds or defects or sores that won't heal on their own. I can help bring in new tissue to help regenerate those areas. I also am able to help patients from a hand surgery standpoint. I do carpal tunnels, trigger fingers. I treat patients for Dupuytren's disease, fix hand fractures, nerve repairs, scar revisions, all of those things. And it's great that I can practice all of plastic surgery and hand surgery and not be confined to just one area. We are able to offer cool sculpting for patients who are disinterested in surgical body contouring, but would prefer to do it in a slower kind of office-based setting. As well, we've purchased some lasers, which allow us to do a lot of skin rejuvenation, scar revisions, and then help people who have some skin disorders as well. In addition to that, we have laser hair devices to get rid of those stubborn hairs that people don't like. Everything we do is very intricate and requires fine motor skills. I like that it requires a high level of technical ability in order to achieve the goal. Hand surgery, it follows that same pattern in that everything within the hand is very small and minute, but has a big influence on the overall function of the hand. So for me, being able to use some fine-tuned skills to achieve a goal is very rewarding. I'm married to Carla Hill, and we have been married for 17 years, and she has been my foundation through my entire journey. We met and started dating before I went to medical school, so she has seen me every step along the way, and it's quite a lengthy process to get from medical school through residency and 2 fellowships. We have 2 boys, Alistair, who's 7, and Kenyon, who is 9. When I leave work, I look forward to nothing other than seeing them at home and spending time with them. That's how I de-stress, is going home and playing with my boys. The most inspirational person, I think just in my life in general, would be my father. My father was an engineer, so he was always tinkering around in the garage or fixing something up, working on a hot water heater or installing a toilet or something like that. I was right next to him helping him. That gave me the appreciation of hard work and then also using my hands for whatever work I do. So that's how I kind of fell in love with the idea of becoming a surgeon. I knew that I wanted to be in medicine, and then using my hands to heal people is what got me interested in a surgical specialty. Medicine has become quite a big business nowadays, and I feel like Froedtert South has gone out of their way to make sure that they still let each and every patient know that they're important and that they're not a number. They're not just a way to make ends meet for the hospital. If a patient knows as much as they possibly can, they're going to do way better than someone that isn't as well informed. What I think brings me the most reward is knowing that I've helped that patient to the best of my ability and that I've made them hopefully a little bit better or brought them some relief. I'm Brian Hill, and I'm a plastic and hand surgeon at Froedtert South.